Podcast. I'm your host, Dr. Spencer Nadolsky, and today we have with us one of our awesome nurse practitioners, Shawn Hennessy. We're going to be talking about some of the stuff we've discussed before, but into more personal detail about stigma and biases in healthcare and the training of such. So welcome, Shawn.
Thank you. I'm excited to talk about this and kind of talk about it from both a clinician standpoint and also like a personal standpoint and what I've seen.
Yeah.
Into it.
Yeah. So what was your foray into healthcare in the first place? Like how did you get into it?
I was always really interested in like human biology, how the body works, and understanding that and kind of simplifying. A lot of it can seem really complex and confusing, and some of it is, but some of it really can't be simplified. And I liked being able to kind of simplify things and explain things to people and understand things better myself that way. And I like people, and so combining the two, it just felt natural to go into healthcare. And so I went to nursing school and then NP school, nurse practitioner school, and I've been an NP for about 8 years now, and it's been great.
Yeah. What got you into then like obesity medicine? Or you're always into kind of just health in general? Like, hey, this is kind of a big deal for health. So how did you get into that?
Honestly, in the last maybe year and a half, as I myself have kind of gone on this personal journey of learning more about some of these medications in trying to improve my own health, and taking some of these medications myself. It's more than a year and a half that I've been working on, trying to achieve a healthy weight, which I think a lot of people can relate to. And so after not having any really great resources, and then this new class of treatment out there with GLP medications, it was really exciting and interesting to me personally, but also I wanted to then give that to other people. And so it was kind of taking the initiative to learn about these medications. But I feel like if we can expand access to care to a population of people who often struggle getting that access, then I'm hopefully doing a little good in the world.
So yeah, how'd you get it? Like, how did you end up on these? Did you were looking for help, or how did that work?
Yeah, so I decided that I had tried every fad diet, I'd done things like Nutrisystem, and I had tried Plenity, and I had tried some other medications. None of it really worked. Restricting carb intake to like 20 or 30 grams a day worked, but that's really restrictive and hard to maintain. And it felt kind of like torture, honestly. And even after torturing myself for months doing that, it would be like, getting into an overweight category instead of an obese category. It still wasn't bringing me down to a healthy weight. And so I'm getting off track now. What was even the question?
Yeah, you were just frustrated with the old treatments because they weren't working.
Nothing was working. And so it felt like by learning about some of these GLP-1 meds, I tried to see if I could get on Wegovy about a year ago. And I was told, even if you get the prior auth, you're not going to be able to find the drug anywhere. So don't even bother. And then Mounjaro came out with a coupon. And that was like the golden ticket at the time to be able to actually have access to this medication, which
Gotcha.
Was life-changing.
And what was it like getting on it?
Oh my God. It was like instant relief in a way that like I felt satiated after, an appropriate sized meal. I wasn't thinking about the next meal. I wasn't having the guilt that if I ate, a little bit more than I thought that I should have, that if I wasn't like intentionally restricting that I felt guilty about it. And suddenly it felt like, is this what it's supposed to feel like? That people who don't struggle with this, that they have this experience every day, that I've been, having the opposite of that forever. And so it was a complete relief. And I hear that from so many patients. I mean, it's the same kind of thing, that the food noise is quieted, and that, you're not having to have that like constant background thought of what am I eating? What should I eat? Is this okay? Is this going to sabotage the work that I've put in for the last week? All of that.
And when you like went for the like looking into the drug, did you feel like did you have to advocate for yourself, or was it like how did
So
that work?
I reached out to my primary care doctor, who is um, open to this stuff and interested. And I made an appointment specifically to talk about this. And I said, hey, I just learned of this drug called Mounjaro. And the good news is that I don't even need a prior auth. I can use the coupon. And she said, I just listened. I'm not saying this to your horn, but she said, do you listen to the Docs Who Lift podcast? And I said, I have. And she said, I was just listening to it yesterday and they did an episode talking about that. And I thought she wasn't aware of the coupon, but she was like, I thought I'd like to try a patient on this. And I think you'd be a good one to try. Let's see how it goes and let me know if that coupon
Wow.
actually works. And
What
so
a small world.
Totally. I emailed her after I used the coupon. I was like, hey, FYI, that coupon works. And she was like, amazing. Like, this is what I'm going to for all my patients now because you can't get anything else anyway.
Wow.
Yeah.
So for those listening, it's another podcast I do with my brother. He's an endocrinologist, and we have brotherly love fun on it, making fun of each other, but talking about obesity as well. So that's actually really funny. So okay, so you started on it, and then once you started going, you're like, you know what? I don't know, how did you go? Like, you know what? I want to do this too. I want to help people with this.
It was really like soon thereafter that I thought like people are going to have access to this medication via the coupon. And so many people are out there struggling. So many people want help and kind of come with trepidation, not sure how their provider is going to respond when they ask for help. And so I had patients on in my full-time job that would come in and nervously say, I've really been trying for a long time and I've been struggling and I want help with this. And so I just kind of, I think, started taking people and they were referring people to me. And then I found my way to Sequence, but super open to like learning about this medication, teaching people about this medication. And I think that the more providers that are willing to do that, the better, because there's nothing else out there previously that has worked like GLP-1s do.
Yeah. What have you learned about like stigma during this whole like time, even when you're trying to lose weight before and now what you're doing now?
Well, I've been probably of a privileged bunch in the sense that because I work in the industry, I've been able to handpick my providers and know these people kind of personally and professionally. And so I haven't ever really experienced stigma, but you can, or not that I've perceived at least, but you can see, that gowns often don't fit people, that our system is just made for people with a normal BMI. When in reality, 2/3 of Americans have overweight or obesity. And so we just kind of live in a world that isn't really made for that. In my own education as an NP, I recall one lecture, and I'm not even sure that it was a full lecture on the treatment of obesity. It was primarily encourage, reduced calorie intake and exercise. At the time, I think Orlistat was available, but there wasn't a whole lot, maybe Phentermine too, but they were almost kind of discouraged, like, well, the side effects probably, it was sort of the attitude in teaching. I'm curious what you had in your, like.
Yeah, nothing. There was no training. I did it all on my own. Went to conferences starting in med school because it was like, well, they're not going to help me here. And residency was, I don't want to say worse, but it was kind of the same thing. Could tell there was a lot of stigma. In fact, then I did my grand rounds after I'd graduated. I went back and did a grand rounds there. Went over how obesity should be treated like a chronic disease. And what's interesting, I had a patient that has still stuck with me since residency. Now it's like, I can't believe it's coming up on, she's been with me for over 10 years now.
Yeah.
And I wanted to get her Phentermine, but it's controlled. I couldn't do it anymore. I'm out of the area. I'm in California. She's on the East Coast, and I sent her to my residency and said, hey, you guys, I saw this patient while I was there in residency. Could you all see her and continue the therapy, Qsimia specifically, phentermine topiramate, and they wouldn't do it. So I was not happy.
So
and I did the 2 years earlier. I just did the grand rounds and explained. They didn't understand that, no, this drug shouldn't be used long term. I'm like, no, the drug is approved long term.
right,
Blah 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 blah. Anyway, things are improving in training, but like, and I think things will continue to improve because of our new therapies that we have that are, they're not scary, they're not controlled medicines.
right,
And because they're used for type 2 diabetes, okay, well, maybe they're more comfortable. It's going to take some time because even they weren't comfortable with using the new GLP-1s, even for type. I was the only one in the whole, out of all almost 40 doctors in the residency, I was the only one that used these medicines for type 2 diabetes.
wow,
Yeah, it was one of those things where it's like, why am I on the cutting edge? It shouldn't be. I should be, these attendings should be teaching me,
right.
but
You should be
that
learning.
wasn't the case. So, I mean, I think it's going to take some time, but there are new training programs that are doing this. What about like,
Yeah,
you said you had before we got on the call, you said you had a family member that had gone through something. What
yeah.
happened there?
Who asked me to attend an appointment with them, with their primary care doctor, to ask they were aware that I was doing this, seeing that I was having success, and wanted to vouch for themselves for the same thing. And so I agreed to attend. The provider didn't know who I was or that I do this for work. So, but I was, and I shouldn't have been surprised because you hear these stories so much from patients, but it is a different experience when you witness it. It was just an immediate nope. She just kept repeating, there's no magic pill. There's no
Mm-hmm.
magic pill. You just have to put in the work. And this is
Mm-hmm.
somebody who is college educated, works full time, takes care of, kids, runs a house. So the inference was kind of that they were lazy.
Mm-hmm.
Like there was no evidence anywhere else in this person's life to suggest that they're lazy or
Yep.
uneducated. But I think that that's where that bias comes in that
Mm-hmm.
we've surveyed people and done studies on this with doctors and nurses that a large percentage of people will perceive patients with overweight or obesity to be either lazy or non-compliant or less educated or less clean or whatever it may be. And it's kind of deeply rooted, but yeah, there's no quick fix. There's no magic pill. And I was really saddened by it. I left that appointment feeling really upset and disappointed. But nevertheless, they were able to seek treatment elsewhere, which was good.
Oh, yeah. That's, same thing. I overheard, I was busy in the clinic. So one of my patients had to see one of the other clinicians and I could hear it through the wall. And they're like, no, you don't need a medicine. You need to eat some chicken breasts and eat spinach. And I was just like trying to talk to my current patient in front of me. And I was like, oh my gosh, what is going on out there or
Right.
over
If it was
there?
that simple, wouldn't we not see this be such an issue for everybody? And you see it as a provider too. For patients will come in for knee pain, and they'll say they'll start the visit before they even say anything. Well, I know I need to lose weight, and I know
Mm-hmm.
that my weight is probably a factor, and all of that. And it's like, well, okay, maybe that is part of this, but not every person with overweight or obesity has knee pain. So it's not, we would be doing you a disservice to just simply say, yep, lose weight, good luck.
Yeah.
Not to act seriously.
Yeah, the bad cases you see online are like back pain that related to their weight, and then they have a tumor in their spine. Rare, but that's where it's like the doctor's like, just lose weight, and if you put your blinders on and not treat the person holistically,
Yep.
bad things can happen. Yeah, it's really sad. And so you've had to learn on your own, basically. It's what
Well,
you're
that's
saying.
exactly it. And I think that that's the case for a lot of people that as it stands right now, because there's such a paucity of formal education that you have to seek that out on your own, which in a busy world and in an already overburdened healthcare system where it's hard to even find time to do your patient notes and the stuff that you have to get done, it can be hard to carve out time to voluntarily get education on something that you're lacking that education on. And so I think the system also creates an issue there for people.
Yeah. So how'd you learn?
I started honestly learning, like it came up in a TikTok video about Manjaro. That's how I learned that Manjaro existed. But prior to that, I knew about Wegovy, and then I started following people like yourself and reading, some of the medical literature and resources, reading the studies, the Surmount trial, and things like that to better understand how these medications work in the context of obesity specifically, rather than just type 2 diabetes. But that's exactly it. It's just taking the time to research. It's listening to podcasts where people take the time to talk about this stuff, and finding trusted, like well-educated colleagues that you can learn from is kind of, I think, the best way to go about it right now. As it stands today, there's no formal certification for nurse practitioners for obesity medicine. Hopefully that will change, but there's no formal training program right now. It really is just kind of seeking out the literature and trying to find trusted resources.
Yeah, there's some certificates you can get if you do CME and whatever, but I'm not aware of a test and ongoing stuff.
Right, exactly. It's all kind of small module type stuff that you can do.
Yeah.
Which is helpful.
Yeah, there would be, I think there needs to be some more training programs. They're trying to get fellowships for obesity, and there's all sorts of things they're trying to do. I think it needs to start in medical school and then go through the rest of training. Otherwise I don't know what else they're going to do.
So much of what we do. I was reading this article, the Sun Sentinel out of Florida a few years ago did this kind of, I don't want to call it an expose, but they wrote about how there was a lot of OBGYN practices in Florida that were refusing patients that were obese, that they were initiating a weight cutoff of 200 pounds. And there's a lot of data that says that women who have overweight or obesity are less likely to get pelvic exams and to get, routine screenings for things like surgery and whatnot. And they're also at increased risk for those things because of their weight. And so it's surprising that stuff is still so interwoven, but it is.
Interesting. Yeah, that's kind of sad. What about now that you've gotten into telemedicine, have you felt, I don't know, I feel like it helps with the stigma with patients. They feel more at ease. They're not in a clinic, in a gown or something like that.
Exactly. And especially for sequence, where this is exactly what we're here for. So you hopefully don't have to have that nervous approach of what is my provider going to say? Are they just simply going to tell me that, are they going to suggest that I'm not willing to do the work, or that I, just need to work harder, that I'm asking them for an easy way out? Which, by the way, why should suffering have to be part of achieving a healthy weight or achieving some sort of health goal? If there is an easier way to do it, why would we not facilitate that? So
yeah. You don't, one of my tweets was you don't get extra points for suffering.
Right, exactly.
It's true. You really don't.
Easy way out. You still have to put the work in, but it does reduce some of the suffering involved. And I think that that's okay. And that's probably what we also see success.
Technology. That's what makes our lives easier. Cars, cell phones, whatever.
Yeah.
GLP-1s.
Absolutely. So I think, with a practice like Sequence, I think it does break down some of those barriers that people know that this is literally what we're here for to help with. And hopefully we can help with some of the insurance hurdles that have, still come up in navigating shortages and things like that. It's still, unfortunately, not a perfect system because we're still operating within the confines of supplies and insurance and whatnot. But at least that there's a safe place to come and know that we're going to do everything we can. And I think, seeking out somebody who maybe is board certified in obesity medicine, if that's what somebody wants to do, is probably the right move at this point.
Yeah. Anything else of your experience doing this? You see a lot of patients and help a lot of people. Anything?
I think it's just the I sense relief from a lot of people, and I can relate to that sense of relief that a lot of people feel. And I hope that like expanding that access to care to more people who have been waiting their whole life and who have been putting that work in forever and just need a little bit of extra help will make a difference. And I think it is making a difference, and it will continue to. And I also, a lot of people will ask, like, well, do I stay on this forever? Or then we talk about how this is intended to be a long-term chronic treatment, but I'm also like, there's still new stuff coming down the pike. Like the stuff we have today, which is so amazing, may not even be considered the most amazing thing a few years from now. You just
In
never know.
5 years, 10 years is ridiculous. 5 years, the landscape is changing to where
Absolutely, which is really exciting.
yeah, Wegovy is going to be old news soon. It already almost is, but
Almost is, yeah.
we're going to take it. So yeah, they're adding things to Wegovy or semaglutide and to make it even more effective and
Yep.
changing the dosages, all sorts of crazy stuff.
Right.
Tirzepatide, they're changing that similar type of peptide to hit other receptors.
Exactly.
It's going to get nuts. So it's exciting. It's an exciting time. So, and we appreciate you being on our team.
Yes, thank you. I appreciate being welcomed here, and I'm happy to keep helping people.
Well, thank you so much for coming on, and we'll have to have you on in the future.
Absolutely, I'm happy to do it.
All right.